Most people over 60 think stretching is the holy grail for hip and knee pain. They're wrong, and the consequences of this misconception are keeping millions of you trapped in a cycle of stiffness, weakness, and chronic discomfort that gets worse every single year. Here's what the orthopedic surgeons aren't telling you. Stretching alone can actually make certain types of joint pain worse by creating instability in already compromised areas. While you've been religiously doing those hamstring stretches and quad pulls, your real problem has been hiding in plain sight. It's not flexibility you need most. It's strategic movement patterns that rebuild the foundational strength your hips and knees are, desperately crying out for. Research from major medical centers suggests that up to 70% of people over 60 who rely primarily on static stretching for joint pain see minimal improvement after 6 months. Meanwhile, those who incorporate specific strengthening movements designed for aging joints report significant pain reduction in as little as 3 weeks. The difference isn't just remarkable, it's life-changing. But here's the kicker. I'm going to share 7 movements with you today that work better than traditional stretching because they target the root cause of your hip and knee pain, not just the symptoms. These aren't complicated exercises that require expensive equipment or gym memberships. They're simple surgeon-approved techniques you can do in your living room wearing whatever you're comfortable in. Now, I know what you're thinking. You've tried exercises before. You've done physical therapy. You've stretched until you could practically touch your toes to your nose. But nothing seems to last. That's because most programs focus on the wrong thing entirely. They treat your joints like they're still 20 years old. They ignore the specific changes that happen to our connective tissue, muscle fiber composition, and joint mechanics as we age. The 7th movement I'm going to show you is so effective that orthopedic surgeons now recommend it as a first-line intervention before considering more invasive treatments. But here's what's really surprising. The 2nd movement on this list actually reverses one of the most common mistakes people make when trying to protect their knees. A mistake that's probably making your pain worse right now without you even realizing it. Before we dive in, I'd love to know where you're watching from and what's your biggest challenge with hip or knee pain right now. Drop a comment and let me know your age if you're comfortable sharing. It helps me understand what resonates most with people in your situation. Let's start with movement. Number 7, and work our way down to the most powerful technique of all. Movement. Number 7 is what I call the supported hip hinge. This isn't your typical bend and touch your toes movement. This is a precisely controlled motion that teaches your hips to move the way they were designed to, taking pressure off your knees in the process. Here's why this matters. Most people over 60 develop what's called hip flexor tightness combined with weak glutes. This combination forces your knees to compensate for movement that should be happening at your hips. Every time you bend down to pick something up, get out of a chair, or climb stairs, your knees are doing extra work they weren't designed for. Over time, this creates wear patterns, inflammation, and that deep aching pain that seems to get worse as the day goes on. The supported hip hinge reverses this pattern by teaching your body to move from your hips first, knees second. Clinical observations show that people who master this movement often report reduced knee pain within 2 weeks of consistent practice. Margaret, a 72-year-old retired teacher from Phoenix, came to see me after months of knee pain that was keeping her from her morning walks. She'd been stretching her quads and hamstrings religiously, but the pain kept getting worse. Within 10 days of starting the supported hip hinge, she was back to her 2-mile morning routine. 6 weeks later, she told me her knees felt better than they had in 5 years. Here's how you do it. Stand about arm's length in front of a sturdy chair or counter. Place your hands lightly on the surface for support. Keep your feet hip-width apart with a slight bend in your knees. Now, instead of bending your knees to lower yourself, push your hips back like you're trying to sit in a chair that's too far away. Feel the stretch in your hamstrings and glutes, not in your knees. Lower yourself only as far as comfortable, typically until your torso is at about a 45-degree angle. Then drive through your heels and push your hips forward to return to standing. Start with 5 repetitions twice a day. Focus on the hip movement, not how low you can go. If you feel any knee pain, you're probably bending your knees too much instead of hinging at the hips. The support is there for balance, not to hold your weight. But here's where most people make a crucial mistake that leads us to movement number 6. Movement number 6 is the wall side progression, but not the brutal, hold it until you collapse version you might remember from high school gym class. This is a gentler, more intelligent approach that builds the specific type of strength your knees need most. The problem with traditional wall sits is they're too intense and too static for people dealing with joint pain. They create muscle fatigue without addressing the underlying movement patterns that cause problems in daily life. What we need instead is a progressive approach that builds endurance in the muscles that support your knees while teaching them to work together properly. Here's the science behind why this works. Your quadriceps muscles have different fiber types. Some are designed for quick, powerful movements, others for sustained endurance activities like walking and standing. As we age, we tend to lose the endurance fibers first. This means your knees get tired faster and become less stable throughout the day. The wall sit progression specifically targets these endurance fibers while teaching your muscles to share the load more effectively. Studies from rehabilitation centers indicate that people who perform progressive wall sits show improved knee stability and reduced pain during daily activities. Within 3 to 4 weeks, Robert, a 67-year-old former construction worker, struggled with knee pain every time he stood up from his favorite recliner. He'd been doing traditional stretches for months with no improvement. After incorporating wall sit progressions into his routine, he noticed a difference within a week. By the end of the month, he could get up from any chair without that sharp, stabbing pain he'd been dealing with. Here's the progression. Start by standing with your back against a wall, feet about 12 inches away from the wall and hip-width apart. Slide down slowly until your thighs are parallel to the floor or as close as comfortable. But here's the key difference. Instead of holding this position until failure, hold it for just 10 to 15 seconds, then slide back up. Rest for 30 seconds, then repeat. Start with 3 repetitions. Each week, add either 5 seconds to your hold time or 1 additional repetition, but not both. The goal isn't to max out your muscles. It's to build sustainable strength that carries over to real-life activities. If a full wall sit is too challenging, start with a partial squat, going down only as far as comfortable. You can also place a pillow or cushion behind your back for extra comfort. The movement should feel challenging but never painful. And here's something that might surprise you about building knee strength, which brings us to movement number 5. Movement number 5 is the calf raise with a twist. And this is where we start addressing one of the most overlooked causes of knee pain in people over 60: weak calves. Most people think of calf raises as something bodybuilders do for aesthetics. But your calf muscles are actually crucial shock absorbers for your knees and hips. Every step you take sends impact forces up through your legs. Strong calves absorb and redirect these forces. Weak calves let them travel straight to your knee joints, creating cumulative damage over time. Here's what happens as we age. We lose muscle mass in our calves faster than almost anywhere else in our body. This is partly because we spend more time sitting and less time walking on varied terrain. Modern life basically puts our calves to sleep. Meanwhile, our knees are left to handle forces they were never designed to manage alone. The calf raise with a twist addresses this by not just strengthening your calves, but teaching them to work in multiple directions. In real life, you don't just walk straight forward. You turn, pivot, step sideways, navigate uneven surfaces. Your calves need to be strong and responsive in all these directions to properly protect your knees. Research from sports medicine clinics shows that people with stronger calves have significantly less knee pain and better balance, especially when navigating stairs or uneven surfaces. Linda, a 64-year-old who loves gardening, was having terrible knee pain every time she knelt down to tend her flower beds. She'd tried knee pads, different kneeling positions, even raised garden beds, but nothing helped. After 6 weeks of consistent calf raise variations, she could kneel and stand without pain. She told me it felt like her legs had springs in them again. Here's how to do the basic version. Stand next to a wall or sturdy surface for light support. Rise up onto your toes, lifting your heels as high as comfortable. Hold for 2 seconds, then lower slowly, taking 3 to 4 seconds to come back down. The slow descent is crucial because that's where the strengthening happens. Start with 8 to 10 repetitions. Once this becomes easy, add the twist. Instead of rising straight up, rise up and slightly to the right for half your repetitions, then up and slightly to the left for the other half. This teaches your calves to stabilize in multiple directions. For an added challenge, try single-leg calf raises, but only after you can easily do 20 regular ones. And here's a safety tip. If you have balance issues, always keep one hand on your support surface. The goal is strengthening, not falling. But strong calves are only part of the equation, which is why movement number 4 might be the most important one for preventing future problems. Movement number 4 is the seated hip abduction series. This targets the muscles on the sides of your hips that most people never think about but are absolutely critical for knee health. Your hip abductors are the muscles that move your leg away from the center of your body. When these muscles are weak, your thigh bone rotates inward every time you take a step. This inward rotation puts tremendous stress on the inside of your knee joint. Over time, this creates wear patterns, inflammation, and that nagging pain that seems to come from nowhere. The insidious thing about weak hip abductors is that the problem develops gradually. You don't wake up one day with sudden pain. Instead, your knees slowly start hurting more after walking, or when you get up from sitting, or when you climb stairs. Most people assume it's just aging, but it's actually preventable and reversible with the right approach. Here's why seated exercises work so well for people over 60. They eliminate balance concerns and allow you to focus purely on the muscle activation. You can control the intensity precisely, and there's no risk of falling or losing your form. Yet the strengthening effect carries over beautifully to standing and walking activities. Clinical studies indicate that people who strengthen their hip abductors see reduced knee pain and improved walking stability within 4 to 6 weeks of consistent training. David, a 70-year-old retired engineer, noticed his right knee starting to ache during his daily walks around the neighborhood. He assumed it was arthritis and started walking less. After learning about hip abductors and doing this seated series for a month, his knee pain disappeared completely. 6 months later, he's walking farther than he had in years. Here's the basic technique. Sit in a sturdy chair with your feet flat on the floor, knees bent at 90 degrees. Place a small pillow or folded towel between your knees. Now, instead of squeezing the pillow, you're going to work against resistance in the opposite direction. If you have a resistance band, loop it around your thighs just above your knees. If not, simply place your hands on the outside of your thighs and provide gentle resistance as you try to push your knees apart. Push out for 3 seconds, hold for 2 seconds, then slowly return to the starting position. Start with 8 repetitions. Focus on feeling the muscles on the sides of your hips working, not your thigh muscles. If you feel it primarily in your quads, you're pushing too hard or too fast. The movement should be slow and controlled. For a progression, try the same movement standing with the resistance band, using a wall for balance support. But master the seated version first. This brings us to movement number 3, which addresses what might be the biggest myth about protecting your knees. Movement number 3 is the controlled knee extension, and this is where we tackle the dangerous misconception that people with knee pain should avoid using their quadriceps muscles. Here's the myth that's keeping people in pain. Somewhere along the way, the idea spread that if your knees hurt, you should avoid exercises that work your quadriceps directly. The thinking was that strong quads would compress the knee joint and make pain worse. This is not only wrong, it's backwards. Weak quadriceps muscles are one of the primary causes of knee pain in people over 60. Your quads don't just bend and straighten your leg. They're the primary stabilizers of your knee joint. When they're weak, your knee becomes unstable, leading to abnormal movement patterns, increased wear and tear, and chronic pain. The key is how you strengthen them. Traditional leg extensions on machines can indeed be problematic because they create shearing forces at the knee joint. But controlled knee extensions done properly actually teach your quadriceps to support your knee in the most functional way possible. Research from orthopedic rehabilitation programs shows that people with stronger quadriceps have better knee stability, less pain, and maintain their mobility longer than those with weak quads. Patricia, a 68-year-old grandmother, was told by well-meaning friends to avoid any exercises that bent her knees because she had some arthritis. She followed this advice for 2 years, and her pain got progressively worse. When she finally started doing controlled knee extensions, she noticed improvement within 2 weeks. 3 months later, she was playing on the floor with her grandchildren again. Here's the safe, effective technique. Sit in a chair with your back supported and feet flat on the floor. Start with your right leg. Slowly straighten your knee, lifting your foot until your leg is parallel to the floor. Hold for 2 seconds, then lower slowly, taking 4 to 5 seconds to return to the starting position. The slow, lowering phase is crucial. This is called an eccentric contraction, and it's where most of the strength building happens. Don't just drop your leg back down. Control the descent. Start with 5 repetitions per leg. If this is too easy, you can add a light ankle weight, but start with just your body weight. If it's too difficult, don't lift your leg all the way to parallel. Go only as high as comfortable without pain. The goal is to feel your quadriceps working, but never to push through knee pain. Some muscle fatigue is normal and good. Joint pain is not. Which brings us to movement number 2. And this one is going to surprise you because it actually involves doing less of something you probably think is helping. Movement number 2 is the morning activation sequence. And here's the surprising part. It's designed to replace your current stretching routine, not add to it. Most people over 60 start their day with stretching because it feels good and seems like the right thing to do. But static stretching first thing in the morning can actually increase your risk of injury and may make joint stiffness worse throughout the day. Here's what happens when you wake up. Your joints are naturally stiffer because synovial fluid, which lubricates your joints, thickens overnight. Your muscles are also shorter and tighter. Static stretching tries to force this stiff system to lengthen before it's ready. It's like trying to stretch a cold rubber band. You might succeed, but you risk small tears and temporary instability. What your joints need first thing in the morning is gentle movement that encourages synovial fluid production and gradually warms up your muscles. This is called dynamic warm-up, and it's far more effective than static stretching for preparing your body for the day ahead. The morning activation sequence combines gentle movements that target your hips, knees, and the connections between them. Instead of holding stretches, you're creating smooth, controlled movements that lubricate your joints and activate your muscles in functional patterns. Studies from geriatric medicine programs indicate that people who do dynamic warm-ups in the morning report less joint stiffness and better mobility throughout the day compared to those who do static stretching. Thomas, a 73-year-old, former postal worker, had been doing the same stretching routine every morning for 15 years. He'd spend 20 minutes stretching his hamstrings, quads, and calves, but he still felt stiff and achy by noon. When he switched to the morning activation sequence, he immediately noticed he felt more limber throughout the entire day. After a month, he realized he wasn't reaching for his over-the-counter pain medication nearly as often. Here's the sequence. Do this right after you get out of bed, before you have coffee or breakfast. It takes less than 5 minutes. Start with gentle marching in place. Lift your knees only as high as comfortable, focusing on the smooth rhythm rather than height. Do this for 30 seconds. This gets your blood flowing and starts producing synovial fluid. Next, do standing hip circles. Place your hands on your hips and make small circles, 5 in each direction. Keep the movement gentle and controlled. This mobilizes your hip joints in all directions. Follow this with gentle leg swings. Hold onto a wall or chair for balance. Swing your right leg forward and back 10 times, then side to side 10 times. Repeat with your left leg. The swings should be controlled, not forceful. Finish with ankle circles and calf raises. Lift your right foot slightly and circle your ankle 5 times each direction, then do 5 calf raises. Repeat with your left leg. The entire sequence should feel like you're gently waking up your joints, not challenging them. If anything hurts, reduce the range of motion or skip that movement entirely. But here's the movement that orthopedic surgeons are now calling the most important exercise people over 60 can do for long-term joint health. It's movement number 1. Movement number 1 is the functional squat progression, and here's why it's considered the gold standard by orthopedic surgeons who specialize in aging athletes and active seniors. The functional squat isn't just an exercise. It's a fundamental, human movement pattern that you use dozens of times every day. Getting up from chairs, getting in and out of cars, picking things up off the floor, using the bathroom. Every single one of these activities requires squat mechanics. When you can't squat properly, your body compensates in ways that create pain and dysfunction throughout your entire kinetic chain. Here's what most people don't understand about squats and aging. It's not about how low you can go or how much weight you can lift. It's about maintaining the neuromuscular coordination that keeps you independent and pain-free. When you lose the ability to squat, you lose a piece of your functional independence. The functional squat progression is designed specifically for people over 60 who may have joint limitations, balance concerns, or previous injuries. It starts with supported movements that anyone can do safely and progresses gradually to more challenging variations. The goal is always function over performance. Research from major orthopedic centers shows that people who maintain squatting ability throughout their lives have significantly lower rates of hip and knee problems. They also maintain better balance, stronger bones, and greater overall mobility well into their 80s and beyond. This exercise targets every major muscle group in your lower body simultaneously while teaching them to work together as a coordinated unit. Your quadriceps, hamstrings, glutes, calves, and core all have to collaborate to perform a proper squat. This integration is exactly what your body needs for real-world activities. Eleanor, a 75-year-old widow, was struggling to get up from her favorite armchair without using her hands to push herself up. This seemingly small limitation was affecting her confidence and making her feel old and frail. After mastering the functional squat progression over the course of 3 months, she could stand up from any chair with ease. More importantly, she felt strong and capable again. Here's how to start the progression safely. Begin with box squats, using a sturdy chair or bench that's about knee height when you're sitting. Stand in front of the chair with your feet slightly wider than hip width apart, toes pointing slightly outward. Lower yourself slowly until you're sitting on the chair, but don't relax completely. Keep your muscles engaged. Pause for 1 second, then stand back up without using your hands for assistance. If you need to use your hands initially, that's fine. Work toward doing it without hand support. Focus on sitting back into your hips rather than bending your knees forward. Your knees should track over your toes, never caving inward. Keep your chest up and your weight evenly distributed across both feet. Start with 5 repetitions twice a day. Once you can do 10 repetitions easily without hand assistance, progress to a slightly lower surface. You can stack books or use a lower bench. The progression should be gradual over weeks or months. For those who find even the chair version challenging, start with wall squats. Stand with your back against a wall and slide down only a few inches before standing back up. Build your range of motion gradually over time. The beauty of the functional squat is that it scales to your current ability level, while always providing room for improvement. Whether you're currently using a walker or you're hiking mountains, there's a version of this movement that will benefit you. Advanced practitioners can progress to single-leg variations or add light weights, But remember that the goal is always functional movement, not maximum challenge. You want to feel capable and confident, not exhausted or sore. As you incorporate these movements into your daily routine, remember that consistency matters more than intensity. It's better to do a few repetitions every day than to do a marathon session once a week. Your joints respond to regular, gentle stimulus much better than sporadic, intense efforts. These 7 movements work synergistically. The hip hinge teaches proper movement patterns. The wall sit builds endurance. The calf raises provide shock absorption. The hip abduction creates stability. The knee extensions build strength. The morning sequence prepares your joints for the day. And the functional squat integrates everything into real-world function. But here's the most important thing to remember. Pain is not a normal part of aging. Stiffness is not inevitable. Loss of function is not something you have to accept. Your joints are remarkably adaptable, even in your 60s, 70s, and beyond. With the right approach, you can maintain and even improve your mobility for decades to come. The key is working with your body's changing needs rather than against them. These movements acknowledge that your 60-year-old joints aren't the same as your 20-year-old joints, but they're still capable of remarkable things. You just need to train them appropriately. Start with the movements that feel most accessible to you. Master the basics before progressing to more challenging variations. Listen to your body and adjust accordingly. Some days you'll feel stronger, some days you might need to dial it back. Both are completely normal. If you have significant joint damage or have been dealing with chronic pain for months or years, consider working with a physical therapist initially to ensure you're performing the movements correctly. These exercises are safe for most people, but individual guidance can be invaluable, especially when you're starting out. Remember that movement is medicine, but like any medicine, the dose matters. Too little won't help. Too much can hurt. The sweet spot is that place where you feel challenged but not overwhelmed, where you can feel your body getting stronger without pushing through pain. Your hips and knees have carried you through decades of life. They've climbed mountains, chased children, danced at weddings, and supported you through countless daily activities. They deserve your attention and care now. These 7 movements are your way of giving back to joints that have given you so much. Most importantly, remember that it's never too late to start. Whether you're just beginning to notice some stiffness or you've been dealing with joint pain for years, these movements can help. Your body has a remarkable capacity for adaptation and healing at any age. The research is clear. The anecdotal evidence is overwhelming. People who stay active and maintain their joint mobility throughout their lives not only feel better, they maintain their independence longer, have fewer falls, require fewer medical interventions, and enjoy a higher quality of life well into their later years. But beyond the research and the case studies, there's something more fundamental at work here. When you can move without pain, when you feel strong and capable in your body, it changes how you approach life. You're more willing to try new things, go new places, take on new challenges. You feel younger, not because you're trying to turn back the clock, but because you're fully inhabiting the body you have right now. These movements are about more than just reducing pain or preventing injury. They're about reclaiming your birthright to move through the world with confidence and capability. They're about refusing to accept limitations that aren't actually necessary. They're about choosing to age actively rather than passively. The choice is yours. You can continue doing what you've always done and hope for different results. Or you can try something new, something that's specifically designed for your body's current needs and future goals. Something that acknowledges where you are right now while helping you get to where you want to be. Your joints are waiting for you to give them what they need. Not more stretching, not more rest, not more hoping the pain will go away on its own. What they need is intelligent, progressive movement that builds strength, stability, and confidence from the ground up. These 7 movements are your roadmap to better joint health. They're not magic, but they are effective. They're not complicated, but they are comprehensive. They won't work overnight, but they will work if you give them time and consistency. The science supports them. Orthopedic surgeons recommend them. and thousands of people over 60 have used them to reclaim their mobility and reduce their pain. The only question now is whether you'll join them. Start today. Start with just one movement. Start with whatever feels manageable right now. But start. Your future self will thank you for taking this first step toward stronger, more resilient joints that can carry you confidently through all the adventures still ahead of you. Which of these 7 movements resonates most with your current situation? And what's the first step you're going to take to begin incorporating it into your daily routine?